yesterday when I saw your picture, I said, hey.
Okay.
Hey, Dr. Eddie, you're a swaggly shot. You know, yeah, Gen Z doctor. How are you?
Fine, how are you too?
I'm fine, thank you. It's good
Thanks
to have
for
you in the
having me.
studio.
Thanks for having me.
Yes, and thank you for honoring our invitation.
It's a pleasure.
So today we want to talk about, you know, what's next with regards to breast cancer, because people get diagnosed, they don't know what to do, they don't know how to handle it, you know, and even when they're able to beat it, what are they supposed to do? We don't have it, how do we support those people to be able to fight that battle? Because it's not a single fight, it takes everybody to fight it as well. So that's why we brought you here this afternoon, Doc.
Thanks for having me again. And good afternoon to your audience, and good afternoon to my colleagues back at work at Kolibu Polyclinic. Right. And I know they're still working, they are watching the show.
Oh, good afternoon to you all.
Anyway, shout out to them. Yeah. Every year, October, we all go pink. We make the noise, we get screened. And after 31st October, what next? You just have to remind ourselves that the screening doesn't end in October. It's a year-round thing. Because if you pick up your lump in January, I get to wait for me in October before you come and get yourself checked out. So we should encourage ourselves to continually do the screening. So you come to the hospital. At my hospital, we have a women's clinic. So on Thursdays, you come, anything women health, we sort you out.
So it's not only in October that you do
October is when the awareness gets louder, everyone is on board. But between January and September and December, it's quiet. Okay. So you should still walk into the hospital and get yourself screened because, as I said, when you pick up your lump in January or February, I get to wait till October. And statistics show that most people report in after 11 to 15 months when they notice the lump. So if you even do juxtapose, 12 months from now is October. 15 will be somewhere in April, May, the following year. So you don't have to wait till October when everybody's making noise, then you come and get yourself screened. So that's must. So we encourage ourselves to check your breast yourself. Okay. Know your breast. Okay. Know your body. I always tell my patients that you should learn to know how your body looks like, how it feels, so that when you notice any change, you are quick enough to report. Because if you don't know how your breast feels like out of your menstrual period, you wouldn't know when there's a lump in. Yeah. And those who are married, we encourage your partners to also help in the examination because it's the two.
Yeah, two. But you see, we hear that when the men suck, it helps. But some doctors too say it's not true.
It doesn't help.
It doesn't help.
The role of the breast, yes. But it's when you are breastfeeding. Okay. So you've delivered after your 9 months, you are breastfeeding your child. During that breastfeeding period, there's what we call breastfeeding amenorrhea, where your body doesn't produce the estrogen. So the estrogen is one of the risk factors for developing the breast cancer. So you realize when you get pregnant and you give birth, for a period you don't menstruate. So that period when you're breastfeeding effectively every day for your baby, you don't menstruate, you don't get yourself exposed to the estrogen, and it reduces your risk. So that's what we encourage. So breastfeeding, apart from the nutritional values for the child, you bonding with your child, actually reduce your risk of being exposed to or getting breast cancer. So I would encourage everyone, if it's possible, you should breastfeed your baby, not your husband.
Okay. Not your husband, but rather the baby.
Doing this, yes, because at that period, that's more protective for the woman.
Okay.
So yeah, the screening.
So what about those who have either hit menopause or have decided to take out their womb? Because at that time, are they also producing estrogen?
No, so at menopause, you don't have estrogen. Okay. Your levels go down drastically. And most of the time, you can't contain the hot flashes you're having, the mood changes you're having. And some are sometimes put on hormonal therapy. Unfortunately, since you're being given the estrogen hormone to help ease your postmenopausal symptoms, you're actually increasing your risk of getting the breast cancer. Some women also have dry vagina, so sometimes the estrogen creams help to moisturize and help them have better sexual experience. All these are good, but you should know that you should limit your duration of exposure so it doesn't increase your risk of getting
so what the application of these lubricants
which contain estrogen.
Which contains estrogen.
It's the hormone estrogen that's your risk. So once you're exposed to it prolonged, then your chance of getting cancer is increased. So try and minimize your exposure to it. That's why when you're pregnant, the 9 months you don't menstruate. The 1 year, 2 years you don't you breastfeed. You also don't menstruate. So you are protecting yourself for about a year, 2 years when you get pregnant and you deliver. So that part is protective. If you get an early menopause, you've reduced your duration of being exposed to estrogen. Okay. If you get an a late time when you start your first menses, so you are reducing your... But these days, our kids by age 9, 10, they are menstruating.
What about those that probably they have fibroids and so they go take out their womb? Do they still produce estrogen?
So that's a separate... Estrogen is produced by the ovaries.
Okay.
So if you are taking out your womb, it depends on the procedure the OBGYN is going to do for you. But sometimes they preserve the ovaries so that we don't initiate or we don't give you a premature menopause. Because if you're not 50, 55, and you're going to get your womb taken out, I don't want you to start having postmenopausal symptoms as early as 35 or 40. So we preserve the ovaries for you. But if there's a problem with the ovaries that needs to be taken out, then we'll take them out. And we find ways to help you cope with...
But if you keep the ovaries, then you're producing estrogen.
Yes, you produce the estrogen.
Oh, so it's not just about the menstruating.
No. So one thing, the body is producing enough. So the body is designed to produce enough estrogen for you.
Okay.
So just that if you're exposed for a longer duration or when you go and take from the creams and from the pills, then you are increasing the concentration in your system.
So what about those who have PCOS and doctors give them these medications to help boost their estrogen?
So, I mean, it all comes with a risk. So we always have to do a risk-benefit analysis. You have PCOS, you're having fertility challenges. I'm trying to help you conceive. When we get to that conception, then we know, okay, we have to titrate or manage the concentration of the medication we are giving to you. So, I mean, it's individualized. What I'll do for Rosalind is different from what I'll do for Mabel. So I have to look at it in that context so that we don't put too much risk or you put to get the illness.
I see. There are so many ladies out there who are taking, you know, these boosters. You know, they say I have to be on, what? There are some boosters they have. It's supposed to be vitamins to boost. Is it advisable? Some of them take it from probably 20 because they don't want to get married and they'll struggle having children and all. So
advisably, I mean, for a healthy lady who is in we call it a productive age. So once you start menstruating, at least we want you to take regular folic acid or folate. Ensure your iron levels are optimum because you are bleeding every month, you are losing some blood. Folate acid also prepares you for conception in the future. You may not be pregnant immediately, but it prepares you to get pregnant. Also prevents the child from developing some congenital defect. So this, I mean, it's good. Now, if you eat very well and eat balanced diet, some of this is to be sorted out.
Okay.
But now a lot of us are fixated on taking extra supplements for whatever reason. And half the time it's marketing. So me, the pharmaceutical company producing the products, I'll come and market it very nicely and you pick it up. But does it add up? If you come and we check and you have nutritional deficiencies, then yes, I may recommend to take these pills to, supplement your vitamins and your minerals. But especially if you're eating balanced diet and you're healthy, some of these things, you can actually do away with them.
Wow. So talking about eating healthy, what are some of the foods that you should avoid?
That's individualized, I should say.
Or you should reduce?
General, avoid alcohol. Stop. Just don't drink.
For a woman?
Everybody. WHO has shifted from reducing the quantity of alcohol we drink now to no alcohol at all. Because if I say reduce it from 1 bottle to half a bottle, I can't guarantee that when you go out with the boys on Friday night, you stick to your half bottle. So don't drink at all. Watch your fats. We buy a lot of street food. They are heavily fried. Sometimes we leave the food over again. We eat it. Avoid. The best is try and eat more stewed, more grilled stuff.
So the alcohol, no? Are there types of alcohol? Like wine is parts.
Is there alcohol in wine?
No, it's champagne parts.
Red wine is good. But then again, as I said, if I say go and drink 1 glass, Rosalind, if the party is late and you're in your mood...
So we can't drink 1 glass.
You should be circumspect about the volume you are taking it. So, yes, watch your fats and oils. Okay. Eat more fruits. Eat more greens. Now we've become more urbanized, so we've shifted away from what our grandmothers and grandfathers used to eat back in the day. People are buying the fast food, the burgers, the Indomies, the check, the fried rice. And they have, oil not doors, so it's heavy. Yeah. So this doesn't help us at all. And we are not living an active life. You sit in your car from your house to the office, you are barely walking, you are barely going to the gym. Little physical activity. And we are gaining the weight and adding other issues to our health, which is not helpful.
So in the unforeseen circumstance where the person is diagnosed,
yes,
how is a person supposed to take it and what lifestyle is a person supposed to live?
So diagnosis, it starts with the family. So I always say, so once a lady picks up a lump in the breast and she reports to the hospital, she needs the support at that time because it's not been confirmed that it's a cancer or not. The trauma or the anxiety with going through the investigations to be confirmed can be very traumatizing. So the spouse, family, friends, church, that's when you start giving the support. Okay, we are with you in this. Whenever you need help, talk to me. When it comes to the hospital too, I mean, that's an opportunity for us to also learn. Because sometimes we don't have enough information and we may add to the trauma at home. So from the start, get the support from the home. So if she's married, family, siblings, support her through the process. Then once it's confirmed, yes, we get the clinical psychologists to also come in to ensure that, I mean, because it can be very distressing. It's a life-changing diagnosis that we are giving to you. So that emotional support is there. Finances, it's expensive to treat. Fortunately, NHIS covers some of the costs, but it's still expensive because at the end of the day, I'm going to work. I have to readjust my budget from probably my kids, my business to my health. So if anybody can help financially to it helps because it also eases the burden on the patient. I mean, kudos to the teachers. They have this free cancer treatment for their members with one of the private facilities. So they go there, 100% coverage for their members. I think other corporate institutions, other unions can actually take up such an initiative to support them because the financial burden on the individual can be very, very tough. Then if you are the family, they need family therapy because at the end of the day, my mom is sick or my wife is sick, a young couple, 2 years marriage, wife picks up a lump, I'm a single, the anxiety of me becoming a single father is there. So if you don't get them to manage the stress early enough, it can be a very big toll on them. Then, I mean, the community comes in. We are a very, very religious society, so church, mosque, we get the support from the church so that, I mean, because sometimes your faith is tempted at that time. You want to be sure if God really allowed that to happen to you. So we have to, look at this. Get your pastors, your spiritual leaders to also come in. And at least, we are not solving your problem 100%, but we are easing the way you receive the news and navigate through the process. These help.
Now, one thing that people have been saying is we are seeing the increase because of the kind of spices we use, the fertilizers that are used in growing our food. Is this true? Could that also be a contributing factor?
So currently, there's no set data, so I can't comment on it. But, I mean, our lifestyle has changed significantly for what we were doing probably in the early 2000s, or probably in the early 2010s. Every decade, there's a shift. So we are getting ourselves exposed to a lot of chemicals that are not healthy for us. Not being political, but Galamsey is there. We are probably waiting the next 10 years to see more effects than just the birth defects from the way they are handling our water bodies. So, I mean, yes, we are explaining ourselves day in, day out to things that we don't have enough information about to actually make that attribution to it. So, yes, we never know what we'll find in the next decade or two.
Wow. I think our studio audience, I'll give probably 2 people an opportunity to ask questions because I know you want to ask your questions. And one thing that we are getting to know too is that men also stand a chance of being diagnosed with breast cancer.
Yes.
So but how do men produce estrogen?
We all have estrogen.
Is it as much as the women? Because they don't menstruate.
Both men and women, we all produce estrogen and testosterone. Testosterone is the male hormone.
Yes.
That women have low testosterone, whilst men have low estrogen. That's where the balance comes in, just to make you more woman, more man. But sometimes you never know where the tumor may come from that may cause the person to produce the higher levels of estrogen for the men. But then again, any man who has a strong family history of breast cancer, i.e. the mother, the sibling, the sister, grandmother has had breast cancer in the past, his risk of developing the cancer is increased. And if you take 100 people who have breast cancer, about 1%, 2%, unfortunately, are men who get the breast cancer.
Wow.
And because we don't have the big breasts or the big chest, sometimes we report late, and it can be also dire for the man. Because at the end of the day, if you tell me I have breast cancer, me, a man getting breast cancer, sometimes the news can come. But we all have breasts, just as the woman's breast is
You know, usually when we speak about breast cancer, because there's so much highlight on the estrogen and all of that, so some men will think that, oh, because I don't menstruate and because of this and that, I don't stand a chance in getting breast cancer. That's why I had to ask that question. Yeah. All right, so probably just one question. Anybody has a microphone? Yes. Or two questions. I'll do two.
Okay, I want to ask if we have any percentage of people that die out of breast cancer, or because we don't normally say it because of that, and people take it as normal.
Oh, right. Oh, yes. I think I even got this question. I was running a breast cancer awareness campaign at church, and the men will always come to me, oh, why is that every time breast, but we don't really hear much about prostate cancer even for the men. So in Ghana, most people present late, and about 80% of all the breast cancers, they'll come very late. And that means about 58% of them are going to die. So that's half the people who will be diagnosed with breast cancer because they're coming at a very late stage. And unfortunately, even the numbers, about 30% are under 35, who are the working age, newly wedded, new mothers. So if you are losing that chunk of people every year to breast cancer, then something has to be done about it. You know, the elderly are not dying, the younger ones are dying. And about 80% are also under 50, 55 years. So a chunk of the working age or class are the ones who are being affected most. And that's it. And we don't screen enough. Even though we make noise in October, they're screening. My grandmother in the village may not get the opportunity to come and get screened because accessibility to health service is limited to where she finds herself. Sometimes the noise is just limited to maybe Accra, Kumasi, Tamale, Takrady, but those in the rural areas don't really get the impact of the awareness. And sometimes we have to actually push and remember them too.
One more.
Okay, so please, recently I saw...
You can get up so that we can see your face. Yes.
Please, recently I saw a trending video of a guy with lumps in the two breasts. Like a girl when you are developing breast, the way it comes. So I went to the comment section and I saw one person comment that he also encountered the same problem, but he was treated at the hospital. So I want to know that what treatment was given to him, and was he like...
And it's a guy?
Yeah, a guy.
Okay.
He had lumps.
Okay, he had lumps in his breast. Okay.
Oh, but... Well, how will I know what the diagnosis was? So I can't comment on what the treatment was. Yeah. But men can sometimes get what we call gynecomastia, where they have bigger breasts, which looks like what? Gynecomastia. Looks like what? It looks like a female breast. Even if you watch, during puberty, many of the males develop a bit of breast buds, and it comes out. But when you phase out of puberty, you get your flat chest again. Yes, and so during that time, there's the hormonal imbalance that goes on. But others, older people, may develop liver disease, which may jump their estrogen levels and may cause them to get the bigger breast. And that will test you appropriately. When you find what is causing yours, when you're able to treat it, you get resolution. Sometimes people also get big, fat. And some of them opt for surgery to actually get it reduced to a bit more flatter, masculine-looking chest for them.
You know, let me ask you this question. There are people who are rich. Yeah. They can afford breast implant. Does getting breast implant reduce your chances of getting breast cancer?
If the breast was taken out, if the natural breast tissue were taken out, then yes. Okay. Because if there's no breast, there's unlikely to get the cancer. So if you take, like Angelina Jolie has done, she took both breasts out. Okay. So if she
put the implant in there.
That can.
Okay, so if
just give the aesthetics of having a bigger chest, but the breast tissue itself is not there.
It's not there. Wow. That's for the rich. You want one last question? Okay.
If I'm right, I overheard you saying, talking about when they are in their menstruation cycle, the chance of, the risk of getting breast cancer is high. If I want to know, what about those that in their period, their blood doesn't flow well and they try to get medicine for them, their blood to flow well? Can that one too also bring a problem to them or getting a cancer or something?
So, point of correction, I didn't say when they're menstruating, their risk is high. So I said when you have a long period of exposure to estrogen, which means you started menstruating at age 8 or 9, and you probably reach your menopause at age 60, you've had a long exposure to estrogen. So that may increase your risk of developing the cancer. Those who have menstrual irregularities may have peculiar issues depending on acosia and AMA. So that has to be investigated thoroughly and the right treatment given to him. So sometimes I wish I were away from giving a blanket treatment regimen. And Ghanaians, as quickly as we are...
We want blanket treatment.
Yes, once it goes out, the people just, okay, he said this, and you go and follow that treatment.
Yeah.
There are a lot of causes for abnormal vaginal bleeding in women, and it has to be investigated and treated accordingly.
All right, thank you so much. And so Loishola Adeyemi is here to read all the messages. Hi, girl.
Hi, Ma.
You look nice, you know. I really love what you're wearing.
I know, you see, it's the last day of October for us on the show. Tomorrow is the last one. But right now, we are here and we are doing, you know, October things. It's the last day of October for us on Changes.
Yes.
Because next time you see us, it will be 1st of November. So, you know, I decided, let's pink it out a little bit, okay? Yeah. So when we are done, we'll change the dress. But yes, social media has commented. A lot of people are following the conversation, obviously, so we'll take a few of the comments. This one says that, I really like Joy Prime Station. It makes me happy.
That's so sweet.
There's more. This one says that this is Beatrice from Insawam. Hi, Beatrice. Thank you for joining. This message is on the way. And this one says that I am enjoying you live. Also, when you look at our Facebook messages, you see that a lot of people are following the breast cancer conversation, and people are even asking that it extends beyond October. So I think that we've had quite a good month, and we're hoping that we continue. And please, check. Tomorrow is the last day, right?
Yeah.
So check as much as possible. If you were waiting for the end, please, the last people, the backbenchers, let's go and get.
But you know, Dr. Wusu has said that it's not just about the month of October. You can actually go and get yourself screened tomorrow. Next week, 2 weeks from now, the month of December, January, February, every single day you can do so. And it's coming from Kolebu, and you do that from where you are, right?
Yes.
Okay.
My department on Thursdays, we run a special clinic just for women, so anything women's health, come in, we'll sort you out.
Dr. Monica Owusu, thank you so much for joining us today. We are very grateful. We've learned so much, so much. So every lady out there, men.
Thank you.
Everyone. Men, everyone. Go get your breast screened so that you can live longer. This is all time will permit us for this segment. Thank you so much, Dr. Monica Owusu, once again.